Hello. So I am responding to the forum questions. And in response to number one, why is it inappropriate to ask a doctor to write a note about being taken to an ER doctor for a mental health crisis? I would say the reason you shouldn't ask the doctor to write a note about when the child can return is because there's not always a certain time that the child will be better, and also it's important not to rush that process or insinuate that you think that a quick return is necessary. And for number two, how would you deal with Tommy if he came back to your class, and what questions would you have? I guess I don't think I would want to overwhelm Tommy with too many questions right off the bat, and I would try to do as much assessing as I could without asking questions, like at first. But then if he seems calm, or I would determine if he seems like calm or upset, if he speaks up in class, and I would look at how he responds to his classmates, and if he communicates with others, and just generally if he seems happy. Then I would ask him how he's doing later on and make sure that I am talking to him without other students overhearing. And if I notice anything out of the ordinary, I would inform the administration as well as the school counselor right away. For number three, what article and why did you choose that article, and what connections did you make? I read the suicide prevention article because I have had a lot of questions regarding this, especially with the recent suicide and how we should respond as a school. I have wondered a lot about how to know if my students are struggling and what I should and shouldn't say. I also think you never want to jump to conclusions as a teacher, but sometimes it's hard not to think about what students may be thinking, and like it might be hard. Sometimes it's hard to not start thinking about which of your own students might be thinking about suicide, and especially with the statistic listed in the slides that or in the article. It was in the article that 3 students in a high school classroom will attempt suicide in a typical academic school year. I think that's really concerning. So that's why I read that article. And then number 4, I would say the information on social anxiety disorders was helpful to me, as well as the criteria listed, like avoidance and persistent anxiety. And it was interesting to know that it occurs most often in females. There are a lot of students who express a fear of speaking in our class, and I also thought it was interesting that OCD shows up early in life, and obsessions and compulsions were very important as they relate to some things that we often see in school. I know we have like some students that seem like they maybe have like certain OCD type things, and so I guess just like reading about that is helpful. And I also thought it was interesting that the mean age of anorexia is 17 years, and that this often occurs very early on in females primarily, and that substance abuse and depression can be common in people who are bulimic, because I guess you don't typically think of having multiple issues like this, and so it's just helpful to keep in your mind that if one of these things occurs, typically another one will kind of go along with it. And then also it was interesting to learn that depression can manifest as agitation and or anger. I guess oftentimes when I think of depression, I think of someone who seems like uninterested and just kind of doesn't care. And so I don't often think of kids who are angry as maybe being depressed, but that was interesting to me, very helpful to know. And then 60% of bipolar patients will develop a substance abuse problem in their lifetime. That just kind of like goes along with what I said earlier. Like um, some of those problems, or like some of those disorders, can, if they're not treated, lead into substance abuse. And so that's just something to remember. Many of these mental illnesses are also very common and they start young. And so I think that's one of the most important things with this lesson is that many of them can also increase the risk of suicide at some point in their life, and they are modifiable. And if we have a bit of information on these as teachers, then we will be able to assist in getting these students help to treat it. And so I think that's why this lesson was important. Thank you.